Knock, knock. Hand hygiene. Close the curtain for privacy. Hi, my name is Sharon. I'm going to be your nurse today. Can I have your name and date of birth?
Robert De Niro, 10/30/92.
Thank you, Mr. De Niro. Okay, so I'm going to be doing a head-to-toe assessment today, just pretty much doing exactly what I'm saying, assessing from the top of your head down to the tip of your toes. Mr. De Niro, do you happen to know what day it is today?
Today is Monday, the 15th.
Very good. And do you know what color I'm wearing?
Blue.
Blue. Do you happen to know who the president is?
Donald Trump.
Very good. So patient is A&O, actually times 4. He also gave me the date as well. So starting off at the top of the head, I'm going to go ahead and just examine. Patient's hair is pretty shiny. It looks good. Down on the scalp, I don't see any redness, irritation. As far as the visual, no lesions, rash, lacerations that I can see. To the touch, patient is also warm, which is normal. Moving down to the eyes. So I'm going to go ahead and do an eye exam. I'm going to put a quick light on one of your eyes and just take a look at it. Just go ahead and look at the tip of my finger and light on. Very good. Look at the tip of this finger and light on. Very good. Okay, so patient is bilaterally perla, which is great. Both eyes are reacting to dilation and constriction. Over to the ears. If we look up and out inside the ears, tilt your head just a bit. Very good. Let me check your other ear. Great. Okay, so both ears bilaterally, it looks like there's a little bit of wax. Very healthy. I don't see any redness, irritation there as well. No excess buildup or cerumen. Down to the nasal cavities. I'm going to go ahead and look up your nose for a moment. Light on. No deviated septum. It looks like his nose is actually aligned. Go ahead and show me your teeth. Very good. Stick out your tongue and say, ah. Very good. Okay. Lips are not dry, not cracked. The gums and tongue are pink. Teeth are in good health. No plaque buildup. No signs of gingivitis. Okay. So at this point, I'm going to get some vitals. I'm going to go ahead and put the cuff onto the left arm. Get my stethoscope. And we're going to pump this up until about 140. And release slowly. Very good. Okay, so patient's blood pressure is within a normal range, 128/78. Very good. We'll go ahead and check his pulse for a minute. Meanwhile, I'll watch for the raise and fall of the chest as well. Okay, so we did the minute. Patient's pulse is at 73, very normal range. Chest rises were bilaterally equal, up and down. Respirations were at 14. So at this point, I'm going to go ahead and check your temperature as well. I'm going to do the tympanic, across the forehead, front of the left ear, behind the ear. Okay, so it looks like a normal temperature of 98.8, normal range. Let's go ahead and check your strength of your arms. Go ahead and push up against my arm while I'm pushing down. Push, push, push. Good job. Now pull against my arm downwards, down, down. Good job. Opposite arm. Push up, push, push, push. Pull down. Very good. High five. Push against my hands. Push, push. Pull towards your face. All right. Very good. If I can have you grab my hand and squeeze them as tight as you can. Very good. Okay, so it looks like the strength also bilaterally equal on left and right side for his extremities as well as his hands. Let's go ahead and listen to his heart rate and, heart and lungs. We're going to listen for a minute each in every area. For the purpose of the video, I will be expediting this process. So, second intercostal space for 1 minute. 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 Okay. Clear lungs, breath sounds. We'll be checking on his back as well. No abnormalities, no heart arrhythmia or palpitations. Can I have you lift up your shirt for just a bit? Thank you. Okay, so we're gonna listen to the 4 quadrants as well on his stomach. We're gonna start at the right lower quadrant, listen for 1 minute, over to the left, excuse me, up to the right upper quadrant, left upper quadrant, down to the left lower quadrant. Visually, I don't see any distension as well before I start this. 1 minute. 1 minute. 1 minute. 1 minute. Active bowels in all 4 quadrants. I'm just going to go ahead and feel around your stomach. Just let me know if you have any discomfort or pain. Doing okay?
Yeah.
Thank you. Okay. How often do you use the restroom, Mr. De Niro?
About 3 times a day.
Okay, that's pretty normal. What color is your poo when you go? Thank you.
Brown?
It's pretty brown. Is it hard when you use the restroom?
Soft.
It's soft. Very good. Okay. What about when you urinate? Do you ever have like an odor, any discharge,
No.
frequency when you're urinating? No. Okay. Very good. Do you mind if I have consent to do an exam on your private area?
No.
Okay. So the patient is declining the perineal area for exam. I would go ahead and examine the penis itself. If patient is not circumcised, pull back the foreskin. Observe the penis to see if there's any lesions, rashes, lacerations, irritation to the skin. Also, by the scrotum, lift that up. Really get in there to make sure there's no chafing or irritation in those areas. If the patient states that there's no discharge, I would also look for that as well, just in case maybe they're embarrassed. I would look out for that as well. So I'm gonna go ahead and move down. We're gonna check to see how strong your legs are, okay? So I'm gonna push down on your leg. Go ahead and push up against my hands. Push, 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 push. Good job. And now pull down, pull down, pull down. Good job. Opposite leg, push up, up, up. Good job. Pull down. Okay, very good. So equally bilaterally strong on both lower extremities. I'm gonna listen to the pulse behind the knee. Can I have you slightly bend your knee? Just about here is perfect. For 1 minute. Normal pulse of 84. Let's try this side. Relax. Slightly lift. For 1 minute. Also a normal pulse of 84. We'll move down to these lower extremities. Taking a look at the feet. I'm going to push against your feet. Push down against my hands. Okay, push, push, push. Good job. Pull back towards your eyes. All right. Both feet bilaterally and equally strong. So to the skin of the feet as well, we're actually going to check his cap refill on the toes. We'll get back to the hands in a moment. Within normal range of less than 3 seconds, let's double check the other toes. Very good. So all toes are within a normal range, less than 3 seconds for his refill. On the actual feet, I don't see any redness, peeling skin, athlete's foot, irritation on the feet. Let's look at under his feet. No cracking, no dryness, which is great. Skin texture feels really good. Our patient, Mr. De Niro, is very young, so just about what I expected to see. Let's check the opposite foot. Very good. Yes, again, middle of the insides of the toes, there's no redness, no irritation, no peeling skin. The toenail color itself also very normal. Let's see. No cracks, no dry feet. All right. I'm so sorry. Let me hand hygiene really quickly. And we're going to check your cap refill on your hands as well. Very good. Within the 3-second range, normal cap refill, less than 3 seconds. So far for every finger on the right hand. Let's check the opposite hand. Very good. Left hand as well, normal cap refill. Can I have you turn on over to your stomach? I'm going to examine you from the back side as well. Thank you. You can relax your arms. Thank you. So from what I'm seeing visually, even down to the feet, he also does have the warm to touch feeling on the skin. I haven't seen any rashes, cuts, any ecchymosis, bruising, anything like that. I'm gonna go ahead and listen to your lungs here on the back for 1 minute each. So you can breathe normally. Are you comfortable like this?
Yeah.
Okay, thank you. 1 minute. 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 Very good. Lung sounds clear, no crackling. I don't hear any whooshing or wheezing. Over to the anus. Are you comfortable if I do an exam on this bottom part of your body?
No.
No, patient did decline. In this area, I would actually separate the patient's butt cheeks, look inside for any chafing, any rashing, any discharge, all the way down into the scrotum. If I didn't get a good look the first time with the perineal exam, I have a better look on this angle. I also want to make sure that there's no irritation on the bottom as well. We already asked the patient about his bowels, but she said we're normal. He's going to the restroom 3 times a day. Soft brown stool, very good. Down to the bottom of the leg. Should the patient be wearing shorts, I'd also be looking at the skin. Make sure I'm not seeing any discoloration. Again, the rashing, irritation to the skin. Down to the feet, we've actually already checked his feet. So let's just go ahead and have you turn around. You can get comfortable one more time. I'm gonna go ahead and give you a call light. It's gonna be right here. I'm gonna lower your bed all the way closest to the ground, the lowest it goes. Okay, so this button here on the call light, the big red button, you can press that big red button if you need my help for anything, okay? So I'm gonna head out and document what I found. It's gonna be right here at your reach, okay? Did you need anything before I leave?
No.
Very good. Okay, Mr. De Niro, you have a good day.
You too. Thank you.
Thank you.